Hello, everyone. My name is Akash,
My name's Hirsch.
I'm Rishit.
and we decided to do our topic on people that are dealing with homelessness. We realized that this is a topic that so many of us have been witnessing in our clinics day to day, especially here in Kansas City. And it's a nationwide issue that we thought we could delve into for our PPS assignment. So let's get started. So, the U.S. Department of Housing and Urban Development defines being homeless as a person who lacks a fixed, regular, and adequate nighttime residence. So, oftentimes when we think of people experiencing homelessness, we associate them to, for example, living on the street, but there's so many different forms and types of, I guess you could say, modalities that this exists in. There's people that either live in shelters, people that cannot afford basic housing, so they have to live out of their car. And all of these definitions kind of encompass what homelessness is. And so I wanted to show you this graph to kind of go off of what I was talking about. So homelessness is divided into being sheltered, which is people that usually go to overnight facilities and stuff so that they can have a warm place to live. And then those that are unsheltered. So these can be people that are either living on the street, living in their car, or either couch surfing with one of their roommates or friends. And so you can see that, especially since the pandemic, we've been seeing this trend, and this is all data that's collected by the U.S. Department of Housing and Urban Development. So what they do is every year, they create this close to 120-page document where they go through all of the factors that people that are experiencing homelessness face, kind of collecting demographic data and state data. And so it's a very detailed report that the government attempts to do. And so based on this data, we can see that especially after the pandemic, with trends and with social distancing and stuff, that the amount of people that are unsheltered definitely increased. And that there's been a slight increase in the amount of people overall that have been homeless. And so right now in the U.S., the best estimate that we have as of 2022 is that 582,000 people are homeless. And so looking at this based on a state level, we can kind of paint a better picture of what's going on. So this map over here basically analyzes the total people that are homeless per state. And so you can see in Missouri, for about 10,000 people, we are in the middle of the road. About 10 to 24 people are experiencing homelessness, and that equates to close to 6,000 people across the state. And so you can imagine the type of impact that this has on our community every year. And so I wanted to talk a little bit about the demographics, since this is a hot topic when it comes to homelessness. And so you can see based on the modality here is that the average homeless man, especially based on what this report says, is that they're typically over 24, and they're males, non-Hispanic, non-Latino, and mainly white. However, one thing that the report does mention that I couldn't really find like a good graphic visual for it, is that this doesn't represent the race and the ethnicity per capita. And so what happens is people that are actually, if you notice, people who are African American make up 32% of homeless people total. However, in the overall U.S. population, only 13% of people are African American. And so per capita, there's actually more proportion of African Americans that are homeless. And so what does this mean? So necessarily there's certain groups that are being targeted more than others in terms of accessibility to housing and to proper resources. And so I thought this was very interesting. So what happens is Alright, so the best data I could find on health resources that kind of impact the people who are experiencing homelessness disproportionately, there's an organization called the National Healthcare for Homeless Council. And what they do is they pull data from, the Health Center Patient Survey Dashboard. This is conducted by the Health Resources and Service Administration, part of the federal government. And what you can do is you can put various different factors into this website. And based on that, it will give you kind of like a disproportionate access, so you can use language at home. If you're below the federal poverty level, urban versus rural, you name it, you could put it in the system and it will give you kind of a comparison. So based on what they found, was that there's quite a big disproportionate amount of access in terms of healthcare, and the people that are facing disease, especially in the homeless, is much more elevated, especially when it comes to diabetes, where there's twice the amount of people, hypertension, people that are prone to heart attack, HIV, hepatitis, depression, and substance use disorders. So there's quite a wide access gap, that still exists in our healthcare system today, despite the many advances that we've made in advancing healthcare from a technological standpoint. We haven't made much progress in addressing it from more of a social standpoint.
In addition to a medical disparity, there is also an ethical disparity when it comes to homelessness. For example, individuals with homelessness have, firstly, a lack of equal opportunity to resources. This includes reduced access to healthcare, transportation issues, food deserts. People with low socioeconomic status, they have difficult access to healthcare just because they can't afford it, and that causes a lack of preventative services, lack of nutritional needs that all create a constant downhill cycle. Secondly, in regards to healthcare, people with homelessness have an increased incidence of chronic health conditions such as diabetes, hypertension, heart attacks, like Akash mentioned earlier. And the average life expectancy of a person who's homeless is 30 years lower compared to the general U.S. life expectancy population. And overall, there's just a constant cycle of going downhill. There's a lack of unstable housing that poses several medical risks, causes longer inpatient stays, then causes individuals to go back to no housing, and then a further decline in their condition. Lastly, it's also important to address the patient-physician relationship when it comes to homelessness. More importantly, it's important to address the stigma around being homeless and creating an open place for individuals to express their medical needs. We don't want to make our patients feel judged for their situation. Some people experiencing homelessness may be reluctant to share personal factors and information due to fear of judgment or backlash, so it's always important to keep an open mind when speaking with our patients.
So one way that we can address these ethical problems is through the ethical theory of principlism. Principlism is an ethical theory that aims to promote positive health outcomes in various contexts. The pillars of principlism are composed of autonomy, non-malfeasance, beneficence, and justice. So the lack of access to various resources results in clear health disparities, as we discussed previously, especially within those experiencing homelessness. Thus, the central problem of this ethical issue is one of justice. It's also important to answer how principlism is related to the lack of healthcare access. For instance, principlism involves justice, as I previously said, which refers to the concept that all individuals should have equal access to resources regardless of their socioeconomic, cultural, or racial background, and that these distributions should be fair. The distribution of resources should be allotted to the most disadvantaged, such that they have an equal ability to succeed compared to the general population.
Next, it's also important to discuss the ethical obligations that physicians have when it comes to homelessness. So physicians have an ethical obligation to respond to our patients' social determinants of health, which includes homelessness. And as such, we should be addressing the concepts of beneficence, non-malfeasance, and justice to ensure that our patients are receiving the most optimal health care that they can sustain long term. Being able to provide access to equitable resources is an important obligation, as social determinants can have a large impact on one's health. By not addressing these barriers, we're ultimately causing them harm, which can greatly neglect their health. As healthcare providers, we hold a special privilege to identify and intervene in health disparities with the use of our medical knowledge and patient interactions. Healthcare is a vulnerable process, and developing a trustful physician-patient relationship begins with each individual provider. One way that physicians can help individuals who experience homelessness is by being knowledgeable regarding various social services that can assist them in getting access to certain community resources that can make a great difference in their overall health. If we are not aware of these resources, we can participate in systems-based practice and consult other professions within our team to help in assisting our patients. Such as contacting social workers, case managers, mental health resources, and even chaplains.
So, as an institution, we also have ethical obligations that we must fulfill. Medicine should identify the health disparities between those experiencing homelessness and those who are not. Healthcare is holistic in nature, as social health directly affects biological health, as we previously discussed. Therefore, medicine as a social institution has the ethical obligation to identify social disparities, and they also have the ability to explicitly compromise one's overall well-being, which relates to justice, beneficence, and non-malfeasance as the cornerstones to uphold our ethical obligations as a society. So, as for current institutional responses, the American Medical Association, or the AMA, has created a new policy that supports laws and protects the rights of those who experience homelessness by ensuring that these individuals are not criminalized for normal activities such as eating, sitting, sleeping in public places where no other space is available. The best way to identify these disparities is to gain awareness of the matter. One new possible approach is to incorporate awareness of homelessness within the medical curriculum itself. Oftentimes, cities have nonprofit organizations that practice what they call street medicine, which takes a deeper dive into the first-hand experiences of those experiencing homelessness. Street medicine takes a look into living conditions of those experiencing homelessness by going into shelters and camps to provide resources like sleeping bags, basic toiletries, and non-perishable food items. But also, it helps develop a better insight into the living conditions of these individuals that would otherwise be absent in our normal clinic settings. And here are finally our references, and thank you for your time.